Hello friends, today I will show you some exercises for the frozen shoulder. Frozen shoulder is a dangerous thing nowadays. People are finding all around the world. Around 2.1 to 6% of the people, they are suffering from frozen shoulder. The other name of frozen shoulder is adhesive capsulitis. The capsule that we have here, this is our shoulder area. This is our humerus bone. The clavicle bone is here. The scapular bone is this side, on the back side. This is the articulation surface, and we have the capsule here, which is also called the connective tissue. Now, the stiffness, the tightness is found when a person is attacked by frozen shoulder. Now, those who get frozen shoulder, they cannot move up their hand in front or laterally. They can't make their hand like this or put this hand, this part on the other side of the blade like this. So that time at least one person should think, yes, I got frozen shoulder. So what to do for that? Some people has a vague idea that if I do vigorous exercises, if I move it too much, then the pain will go. Never. What happens? The fiber, there's a tear in the fiber and they suffer more. The stiffness, the tightness of the capsule becomes more. So that makes the people suffer more. And mostly the women suffer from frozen shoulder. People suffer from this frozen shoulder pain at night, maximum. Maximum they get the pain at night. I mean, their posture matters a lot. I mean, if you have the pain this side, you are turning this side and lying down, then you will get the pain more. I mean, your posture makes a lot of difference. Some people, they have a habit like this, like sitting like this. Without any reason, they study books or something like this. Somebody, they do like this. So these are the things that put pressure on the capsule and that stiffens and thickens the shoulder area. Now, how to get rid of this? The initial stage, one should do some exercises, a range of movement to make that part, some stretching exercises to make that part strengthen and a little bit smooth. But don't do any vigorous exercise or any strength exercise or too much of movement that will hamper this part. Sometimes the situation or the condition of the patient is so severe that they are bound to go to the doctor. Initially what the doctor does, they give sterilized water, they inject sterilized water on that very part. If it works, it's okay. Otherwise what they do, they use anesthesia and make the patient sleep and then move the hand and the shoulder accordingly. But there is a risk there. Risk of fracture there, it may lead to fracture. It should be handled gently. And at last, it's very rare case that the doctor usually do. There's a pencil-like thing. They make a keyhole here and put it inside and make a tear on the capsule. But very rare case, not even in a percentage. Anyway, let us come to the track. I want to show you the exercises. What exercises you should do. Very simple exercises. You should practice that and get rid of it. Mind it, if you don't take it seriously, this frozen shoulder stays for years also. Maybe 2 years or 3 years. And if you do it properly, within 1 or 2 or 3 months, you can recover that. Okay? First exercise that you should do, I am going to show you that.
Start.
Like this. It should be like a pendulum. Move it. Don't put any extra strain. Move it like this. 4, 5, 6, 7, 8, 9, 10. Keep your back firm, otherwise you'll get pain here. Okay? Hands like this, and from smaller make a bigger circle. Like this. 1, 2, 3, 4, 5, and then again small. Small, small, small. Again make it bigger. Bigger, 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 as much you can. Then make it small, 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 again make it. Do every exercise for 10 times only. The third exercise, try your best to practice if you can. If you can't, I can't help it out. But try your best to practice that. You know, this is very helpful. Just to move your hand like this, rotate it round, all around your shoulder like this, 10 times this way, and then 10 times this way. Okay? 10 times this way, and the other way 10 times. Now in between, what you do, you stretch your arms like this, and then take it like this, and take it like this. Now, if you have any cervical problem or brachial plexus problem, then that also lead to shoulder, frozen shoulder, or if the pain may come here up to your wrist and maybe up to carpal, metacarpal phalanges. It may extend up to here also. So one should check it out properly, whether from where it is coming, because of your posture, because of your lifestyle, or because of this cervical problem, your brachial plexus problem or your cervical plexus problem. Make it sure and then do your exercises. I kept my hand on the wall and slowly I'll come a little bit of backward and then hand according to shoulder level and put my head down slowly accordingly, and stay there for 10 to 20 seconds, and if you can add 5 to 10 seconds more. This is a very good exercise to make this part free, make your capsule free, make the stiffness or the thickness or the pain that you have in this capsule area or the articulation surface, it will go. Yes, put your hands like this, just keep yourself away 6 inches away from the wall, stand straight and then push the wall with your elbow like this. 1, 2, stay there, 3, 4, 5, 6, 7, 8, 9, 10. The same way, if you have the problem here also, you use your left hand. Okay? The help of the other hand and try to push the infected hand like this, painful hand, the shoulder that you have here, and then slowly down. Now, initially it may come up to here, but keep the against the gravity, push it, slowly. If you get too much of pain, leave it. Then again, do it like this. I mean, 2 times in a day, 10 to 15 times, it will help you to recover this part. Okay, this way, and take it like this. Make it shorter as much as you can, and then move it like this. If you got the pain here, so that should be on this part. You should hold it like this, and then the other hand, you pull it upward and down, upward and down, upward and down, upward and down, upward and down. If you wear your shirt, you are finding difficulties, or the daily work that we do, you are finding problem there, then at least we got the problem of initial stage of frozen shoulder. So take it seriously and do practice these exercises. Change your lifestyle. Do visit my article. Go to my website www.dmoitra.com. You will find all the articles related of all these pains and diseases, and write your comment there so that, and what you want, let me know so that I can, in my next article, I write for that. Thank you so much.